I really fell in love with what it was to be a surgeon. You take these people who are really, really sick and see what kind of surgeries we can do to really improve their quality of life and make them better. That's very rewarding. I grew up in Broward County. I grew up in Coral Springs, not too far away from Memorial. I'm one of 6 kids, and I have an identical twin brother. My father's actually a physician, and so it's always been in the family. He's always been very dedicated to his patients and being a doctor, and I picked up a lot of those ideas and skills and traits from him. And then he went even further when I became an EMT, and I was working on ambulances, and that's really solidified patient care, and I wanted to be more involved in doing more. The most common thing that I usually deal with is peripheral vascular disease, which is usually a disorder of the arteries in the legs. And so people usually have pain when walking, or they have wounds that aren't healing, or they even have to go as far as gangrene of the feet. And so my job is to figure out the best treatment for them to get better. That includes using both x-rays and wires and balloons to treat the inside of the artery, then also open surgery to do bypasses to treat, more complex disease. And that's the benefit of being a vascular surgeon, is that we have the tools to do not only endovascular surgery, but also open surgery, which is not a lot of doctors can do. So the other things that I do is venous disease, so people who have leg swelling and edema and varicose veins, I treat that both with open surgery and endovascular surgery. I do a lot of dialysis access, so people who are end-stage renal disease and they need ways to get dialysis, I provide that as well. And then another big part of my job is aneurysms, which are outpouchings of the blood vessels. And so I treat those both open and with x-rays. And also the last thing that I do would be carotid stenosis, so carotid disease. If someone has a stroke, I treat the narrowing in the artery to help them prevent having a future stroke. Vascular surgery is a very difficult field because there's a lot of highs and lows. But the best part about it is having the patient come back and say, hey doctor, the wound is healed. Hey, I'm able to walk and go to my granddaughter's birthday party and not worry about sitting the whole time. I'm able to do things I never could do prior to meeting you. And for me, that's the biggest satisfaction out of my job. I mean, that's it. I mean, there's nothing else beyond the, seeing the patients and the results that they have.